And good morning, and thank you for joining us this morning. This webinar, as you just noticed, is brought to you by the Kissimmee Chamber of Commerce, and it's a way to keep you current on our local health services as we all deal with the COVID pandemic. This is an update to the initial May 6th hospital and COVID webinar that we presented at that time with most of the same panelists. We have a new panelist this morning. You are welcome during this to use the chat function or the comments and go ahead and add any questions you might have, and we'll get those at the end. But we only have really 3 questions today to keep us on short, concise time. I want to introduce our panel. We have 3 guests today. David Carbone, who is the CEO of Osceola Regional Medical Center, Brent Burish, who's president of the Orlando Health St. Cloud Hospital, and Dennis deLeon, MD. And Dr. deLeon is the Chief Medical Officer for AdventHealth in Kissimmee. Gentlemen, welcome this morning, and thank you for joining us. We'll cover the 3 questions that I mentioned. However, if you find it helpful to expand on this, and this is really for our viewers this morning, or any other topics, let us know and we'll do a more in-depth panel at some later date. But today we want to try and keep it short and concise. So let me start with the first question, and I'll start with David, since you're over to my right on the screen here. Tell us about the current status of the hospital regarding available beds and your capacity for non-COVID patients.
Well, for non-COVID patients and COVID patients, we do have capacity. We have plenty of beds. We have ICU capacity as well. What we've seen in the recent spike is a less acute patient coming into the hospital, but many more of them. We do have a separate area in our ER for COVID patients or patients that are under investigation. We call those PUIs. And so they are not commingled with the general ER population. Once they get up to the floors, they're on a separate COVID unit as well. And actually, we have 2 or 3 of those COVID units, depending upon the census at that time. And we have a separate ICU designated just for COVID patients that are positive or under investigation. So we have capacity from a bed standpoint. What we're feeling now is a little bit stress on the staffing standpoint, because we have some nurses that have gone out sick themselves, mostly through community, contracting it in the community. Either their spouse or family members or friends had the COVID or were suspected of having COVID. And so we have a program to monitor those employees, take them out of the work schedule, get them healthy again, and then get them back on the work schedule. And they're paid throughout all that time if they are COVID positive. We're taking care of our own family as well, so that we can take care of patients. So we do have plenty of capacity from an ICU, a bed standpoint. As you know, the spike has just like it's gone through the regular community, it's impacted employee population as well.
That's an excellent point. Thank you for that update about Osceola Regional Medical Center. Brent, can you share a little bit about what's going on at Orlando Health St. Cloud?
Yeah, sure, Ken, and good morning. So Orlando Health St. Cloud Hospital, similar to what you just heard, continues to have capacity to safely care for non-COVID patients and COVID patients. And that includes a multitude of settings ranging from emergency department care, inpatient care, outpatient care, surgical care, and our medical group, or the clinic environments that we have. We do have physical space separations in the hospital for emergency rooms, for inpatient units, for COVID patients. We have testing capacities. We test every patient admitted to the hospital for COVID. We test every surgical patient and every cardiac cath patient before procedures to make sure we know if they have COVID or not. We do have screenings at every entrance into our hospital, doing temperature checks, questionnaires. That includes every team member every day, every medical staff member every day, and any patient or visitor coming into the hospital every day. And we continue to have PPE that we need, so the appropriate masks and gowns and other supplies, so that we can take care of patients and invite their loved ones in when it's appropriate to do so. And we review them all multiple times per week. That includes hospital leadership and a tremendous amount of physician engagement. Now, what I will share is we've had infection control experts safely validate our practices and continue to stay up to date on the latest CDC guidelines, Florida Department of Health guidelines, and others as it relates to treating COVID-19. Is just how selfless people have been throughout this. So David talked about team members. Ours have been engaged and resilient for months. And our medical staff has volunteered and dedicated a tremendous amount of time to making sure that, again, we are staying up to date on the latest treatments, the latest medication therapy, and making sure we have the best outcomes possible for patients. And I just want to make sure that we thank them, not just here at Orlando Health St. Cloud Hospital, but everywhere, whether that's in a physician setting, whether it's mental health, or everyone that's been involved throughout this community. They've really been resilient and done a tremendous job in treating COVID.
Well, thank you for recognizing those front line. And speaking of front line and working with physicians, Doctor, tell us about AdventHealth Kissimmee and how the status is right now.
Sure, Ken. Thank you so much for having us all on. It's an honor for me to represent my boss, Shayla Rankin, our president, as well as the good frontline doctors and nurses here at AdventHealth Kissimmee. Like my colleagues at our other community hospitals, we also have the good fortune, Ken, that we have been able to resupply with PPE. So our personal protective equipment stocks, as well as the crucial numbers of ventilators for our critically ill patients, we're back up to where we need to be. And that was certainly not the case a few months ago, to be honest, but that's a very much better situation now. We have the same staffing pressures, I think, in terms of nurses that many of our hospitals do. And the good news is we've been able, with the help of our system, to float nurses and personnel over from other facilities. We've even recruited and successfully brought in and credentialed nurses from out of state. We have a sister system in Colorado, the Centura system, that's been very generous with their staff. Another thing we're seeing, very similar to my colleagues here, is that as our intensive care and critical care doctors are better at treating COVID, in other words, with knowing which treatments work at which stage of the disease, whether it's convalescent plasma or remdesivir, we're able to shorten the length of stay for those critically ill COVID patients, freeing up beds for all of the elective cases in surgery, as well as routine non-COVID medical care that the community is concerned about. So we too have the capacity to do elective surgery. We're very careful to match supply and demand every single week, every few days, but we do have capacity for the routine non-COVID care, and that's very gratifying and very important.
Good. Well, thank you for that update. Let me ask you the second question here. We'll start with you, and then I'll move around. What data or metrics relating to hospitalizations and individuals with COVID that are available to the public can help the businesses that are with us today on this webinar that are available to the public, can help these businesses determine if the virus is becoming more or less of a challenge here in Osceola County? There's just so much data out there.
It is tough to kind of wade through for any of us, isn't it? So many different numbers. The numbers that we cannot help but seeing are the new case rates. That's very much the front page headlines everywhere in all news organizations. And certainly we got to be sensitive to that. I would also have a suggestion that we look at the positivity rate. And that's simply when you take the number of persons tested, what percentage of those are positive? And that's sometimes a function of how much testing capability you have. Thankfully, in Florida, our testing capability across many different health systems has improved dramatically. But we worry when that testing percentage of positivity is in the obviously 10 to 15% or higher. We'd like to see it well below that. It would be lovely to see it in the 3 to 5%. That would be a number I'd suggest to business owners and others is maybe a little bit more illuminating than just the raw numbers. It can be kind of overwhelming. And another one is, as you said, hospitalization rate, and particularly rate of patients going to, who come to the hospital who go to the ICU. And that should be trending downward as well.
Good. Brent, can you follow up on that question?
Sure. I think the frame of the question for businesses or the public is when do we know it's safe, and when is it safe to go back out? Mm-hmm. And Orlando Health does have a workforce ready group to help businesses that want to reopen or have reopened, but potentially are considering if it's safe to continue to do so or face new challenges. And I think each business, each industry will have some things that are unique. The question, ultimately, we've seen different approaches throughout different states and nationally from public health experts. But I agree that you have to look at the COVID positive rate, the prevalence in the community, as well as the hospitalization rate, the ICU utilization, and mortality rate. And we look at all of them in totality in making our decisions. We believe that even as one wave slows down, there's potentially more down the road. For example, weeks after schools reopen, what that will do to our community. And so I think it's important for us to prepare for that and have businesses do the same. And so our health system is willing to partner. And I've shared before, but I'll share openly for the public. In COVID-19, one thing that in Osceola County I can speak for is I've seen more collaboration across healthcare systems, my two colleagues here as an example, than I've ever seen before. And I think we all recognize the need to work collaboratively. And that goes beyond hospitals to skilled nursing facilities. We have nearly weekly calls with them in our community here about best practices and what they're experiencing and how we can assist each other in infectious control practices and PPE availability and the like. And it is truly a community effort to make sure that the entire community stays safe. And so with businesses, I would expect certainly Orlando Health has their role to play in supporting businesses in reopening or addressing challenges in reopening. But I think all of us together are willing to support whatever it takes to help the residents of Osceola County stay safe.
That's great. It's the neat part. I get a chance to cross multiple counties, and Osceola is a very cohesive community. So that's wonderful to hear. David, share with us about Osceola Regional and how you look at these indicators.
Well, the indicators are important, but they can be confusing and they can be misunderstood and misbroadcast. I know right now Florida is a big target in the national media because of the spike that we've seen. And, a lot of our doctors now are believing that spike was created by the July 4th holidays. You had Memorial Day, you saw a spike after that, and then it's settling down. So here we are almost a month after the July 4th holiday, and the numbers are coming down. So what that says is that, as Brent was saying, it takes a community effort. Everybody needs to socially distance. Everybody needs to wash their hands. Everybody needs to wear a face mask, whether it's required or not by the state or by the local authorities, until we defeat this thing. It can be defeated. It will be defeated. Vaccines are on the horizon. But in the meantime, we just have to be overly cautious. If you're with other people, socially distance and wear a mask and just treat each other with a healthy bit of respect. Regarding the numbers, if you contrast my home state of Massachusetts, I've been in Florida about 30 years, but I still go back and forth. It's about a fourth of the size of Florida, and yet it has had almost twice the number of deaths until this recent spike. So Florida, I think, as a whole, is doing pretty well. Again, as we learn how to take care of these patients better with the different modalities of not only caring for the patients through therapeutics, but also testing has improved tremendously. There was a period of time when many of us were facing 7, 8, 10, 14 days waiting for test turnaround. Our test turnaround time now for the average test is about 28 hours. But in-house, we also have testing capability with what we call rapid testing, both the Abbott Now ID system and the Sophia antigen system, and they both give a result in 15 minutes. They have limited practical use, so we still all rely on the standard testing, which is sent out to a commercial lab. Our lab that we use and have been using throughout most of the crisis is right in Melbourne, and so our turnaround time is generally about 28 hours, sometimes less, sometimes a little more. That's helped tremendously in moving the patients in and out of the hospital, getting them a comfort level to know whether they are COVID positive or not, and then what are the treatment options for them. So the question was about numbers. Numbers are confusing, and even the positivity rate. In the hospital, we're testing patients who are patients. They're sick. When the government and others are testing out in the general population, they're testing massive amount of patients. And so their percent positivity will be lower than that in a hospital setting because people are coming to us when they feel ill and may have the symptoms. So our positivity rates tend to run a little higher than the normal community rates.
Yeah, well, thank you. I'm listening to this, and we had a third question about data, but I think we'd be going over the same thing. Why don't we Brent, let me just put you on the spot here. Just share with us as we kind of wrap up the panel this morning in the short time frame we have, any other thoughts in terms of how employers can work with the local hospital or other advice regarding COVID for their employees?
I think the starting point is we do have subject matter experts within our organization that are willing to help. Infectious disease nurses, infectious disease physicians, occupational health physicians, amongst others, who can give guidance on screening guidelines, on perhaps reviewing social distancing within certain businesses and occupancy, on how to handle potential workforce concerns if your employee calls sick or has concerns that they've been exposed to COVID, and how you handle that. It is something that as an organization we're willing to partner and assist with. And the other thing I think I would just emphasize is technology has its advantages too. I think David touched on the most critical items of social distancing, hand washing, and mask wearing. But there are telehealth options that are available if people are concerned of coming to the doctor or coming to the hospital. I think part of the goal today is to emphasize all of us have safe practices as hospitals. I actually believe that coming to the hospital each day to work is probably the safest environment I can be in, and I say that openly. But if there are concerns in the public, again, there are technological options that are out there readily available to help assist, and same for the workforce.
Good, good. Doctor, what can you wrap up as far as AdventHealth and advice that you might have for the employers?
Absolutely. What I'd say to employers is don't give up on the basics, which is mask wearing, social distancing as provided for in the guidelines that we all know about, being aware, situational awareness generally, re-educating and reiterating to your employees the importance of symptomatic awareness. If you are sick, stay away, call somebody who is an expert, call somebody in your business, in your organization, and ask them how to proceed. Be responsible. It sounds very basic, and it's on the low-tech end of the high-tech scale. But I do want to say, I think my colleagues and I here represent healthcare systems that have invested tremendously in the technological approaches, and that is life-saving. It's dramatic and good, and it needs to continue. But I think for our fellow citizens here in the county, and for businesses and employees, we've got to do the right thing every single hour of every day, and not give up on those efforts, because that's the foundation for everything else.
Thank you, Doctor. You bring up an excellent point, and I'll turn it over to David to finish up. But and that is that while individuals living in Osceola County see individual hospitals, you bring up the point that all three of you represent very large systems. So the nice part is that you have a presence, physical presence in the county, but it's part of a much larger and more powerful system. So that we have the benefit of that in Osceola County. David, if you can finish up for us and address again what Osceola Regional and your recommendations to employers.
Well, again, you're right. The comment about the systems, that helps us bring the resources to bear that an individual standalone hospital may not have. So we are very fortunate in this community to have three strong hospitals from three very strong systems, whether it's PPE, lab testing, technology, getting the latest treatment protocols. It helps to be part of the system and not a standalone entity. As far as the businesses, again, echoing, just, be mindful of how your staff and your customers are. I find it funny that it took this long for many businesses to put signs up, masks required. That should have been day one. And I know we've all been on a learning curve, but we really need to enforce the basics at home, at work, out in the community. Even though restaurants are opened up, you need to be cautious, both for yourself and for your staff and for your customers. But I do want to echo the comments that we've made and heard earlier from Brett and others. It's been a team effort, not just the hospitals, but at each hospital we have a fantastic staff of nurses, other clinicians, physicians, who have really worked around the clock to help our community meet these needs. And in the early days of the crisis, there was a lot of parades and a lot of fanfare and a lot of thank yous, and that's kind of petered off. So I want to extend a thank you to everybody at every hospital for the big effort that they are continuing to put in place. It hasn't gone away for hospitals. It hasn't gone away for our community. It will, with all of us working together.
Well, gentlemen, thank you. It's been a short panel, but a very, I think, informative one. For those who may have seen over in the comment column were the backgrounds on each of our panelists this morning, and also a thank you from one of our viewers for sharing recommendations and resources for the workplace. So I'll echo that for our panel this morning. Thank you all. And also thank you for our members who have tuned in this morning and been part of this as well. I'm sure that we may do this again as time goes on. Hopefully we wouldn't have to, but it seems like COVID's going to be with us for a while. So Dr. and Brent and David, again, thank you very much for your time this morning.
Thank you.
And with that, we'll go ahead and finish the webinar. Thank you to the Chamber for making this possible, and have a healthy day.
Thank you.